Eosinophilic pneumonia is another type of respiratory disease that's been described in these patients with e-cigarette associated respiratory illness. Patients generally do not have peripheral blood eosinophilia, but they may have associated pleural effusions and septal thickening on chest CT. This is typically diagnosed by bronchoscopy. Organizing pneumonia, which is a common response to lung injury, is another pulmonary disease associated with e-cigarette associated respiratory illness and is usually bilateral. Organizing pneumonia often involves peripheral areas of consolidation and/or ground glass opacities. The reverse halo sign may be present on chest CT, where the central ground glass areas and opacities are surrounded by a near complete ring of consolidation. Again, bronchoscopy specimens, particularly transbronchial biopsies, can confirm the diagnosis of organizing pneumonia in these patients.